Yes, so I am excited about this. Our movie night actually inspired this presentation because like you said, pregnancy, welcoming another life into this earth is a biblical thing, and should be treated as such. And I think that in today's world, it's often looked at as like a scary thing, or there's pressure to do things that are not really what God intended. So that's the purpose of this, to just give more not insight, but just inspiration and groundedness in like what pregnancy is, and some healthy tools that you can use when you are pregnant. So this is catered towards the women that are pregnant or trying to get pregnant, but good for men to hear as well if you're going to be supporting your partner getting pregnant. Okay, so we'll begin. Are we ready?
Oh boy. Oh boy.
Okay, so pregnancy is holy ground. Life begins with divine purpose. It's not a medical emergency, it is a natural and spiritual process. God designed women's bodies with the knowledge of how to do this. So I like this verse: you knit me together in my mother's womb. I am fearfully and wonderfully made and perfectly made. The intelligence to grow and birth life. Again, knit me together in my mother's womb. I'm fearfully and wonderfully made. God designed this whole process. Okay. So faith over fear. So culture often promotes fear around birth and pregnancy, while the Bible reminds us that God is with us even in labor. He's designed this whole process. So to speak peace over your pregnancy journey. So I have some verses over here that people, women can use while they're pregnant. So when I'm afraid, I'll trust in you. Blessed is those who believe that the Lord would fulfill his promises to her. Before I formed you in the womb, I knew you. Before you were born, I set you apart. So to kind of like, when we're talking about how culture promotes fear around birth and pregnancy, like my best friend just had a baby, and she was explaining the process, and I was like, that just doesn't sound like what the movies portray it to be. And she was like, yeah, like it's not scary, like it's calm. Obviously it's not comfortable, but like it's a calm experience. Like it's natural. It's not something to be afraid of.
Yeah. Well, I think it's one of those things, right? What does medicine really try to do, right? It's fear-based. You have
Right.
this condition, you have this, you have that. I mean, it's literally driving you in a direction, and fear sells. Honestly, if I scare you into doing something, you're
Exactly.
gonna
Yeah.
do it. And I'm sure you go into it more here. We'll let you keep leading, but I'm sure there's more to this, and we'll talk a little bit more as you kind of dive deeper into this. So go ahead.
Right, exactly. So choosing faith over fear. So on that topic, seeking wisdom, researching with integrity. So approach decisions prayerfully, not reactively. Ask yourself, like, am I making this choice out of wisdom or anxiety and pressure and fear? God calls us to steward our bodies and our children's lives with faith and discernment. So if you're, coming across some decision that, the medical doctors are asking you to make and it doesn't feel right, like trust your intuition. Like you have God inside of your body, like the things that feel aligned and the things that don't. But at the same time, like looking at both medical and ethical perspectives, like doing your research, being informed so that you, and I know, Dr. Bacon, you're all about that, like knowing information before you make decisions, like doing your own research, asking people that you trust. And then, understanding vaccine types, potential risks, benefits in pregnancy and for your baby. So just becoming informed and asking God in times of indecision or fear, like truly leaning on God to make your decisions instead of, fear.
Yeah, totally. And I love the way you keep saying fear, but faith, like having the faith, right? If you know that we've been having children for, you know, forever without medical intervention, and the more we see on news and TV and all this other stuff about how there's all these other problems with the whole birthing process, maybe it's not just the birthing process that really is the vulnerable scenario. Maybe it's the mother, the diet, the lifestyle, the way we're birthing, the stress of the mom, the stress of the whole of the whole birthing process. Like all of these things put you into a position where you're either in growth and repair or you're in fight or flight. And
Yeah.
that to me is, like you said, we had a lady in today. She was going, Doc, I got dizzy and I had, she had a pre-prodromal like headache that was leading into a migraine. She goes, all these people were talking about, you need to talk to your doctor. You need to talk to this. Well, of course, she waited to come to see us. She goes, I don't have a primary care provider. You're it. I said, well,
Yeah.
but we will talk about what creates that and what causes that. What were you doing at your workout before you had that episode? Well, she was doing, I don't know, push-ups on the wall or wall climbs or something like that, which is inverted. A lot of blood rushing where, a lot of pressure,
Yeah.
depleted minerals, depleted nutrients, and all of that stuff made sense. And now she thought she was dying, of course. She stood back and went, okay, this makes sense. I don't need to rush off to the medical community and buy a pill for this or a drug for this. So yeah, the research with integrity. The integrity is my body making a mistake or am I making a mistake? And what do I do to correct it so I help everything work the way it's supposed to? So
Yeah.
yeah, keep going. I'm sorry, Chris. Yeah.
100%. No, I love this. Yeah. And so now we're going to move into the role of chiropractic care in pregnancy. So it can help align the pelvis and spine to prepare the body for birth. It can reduce nerve pressure and have better communication to the uterus and organs, can relieve common discomfort, sciatica, hip pain, back pain, can help the baby position optimally. And obviously, chiropractic isn't just safe during pregnancy, it supports God's design for balance, but we're talking about pregnancy specifically. And I've provided a photo of Dr. Bacon helping one of my friends in her pregnancy to relieve some discomfort. And I know that you have so much experience with flipping babies and all of this stuff, but I don't think that this is well known to a lot of people. I know you have a lot of people that come into your practice that are pregnant, but just how powerful it can be for pregnancy. So if you'd like to share on that.
Well, yeah, I'll elaborate a little bit. I mean, think about it, right? What are we doing right here? I mean, honestly, this is the big idea is laying on of hands. I mean, honestly, it's energy, it's vitality, it's function. So this young lady, I mean, she was 39, maybe almost 40 weeks, right? I think at
Yeah.
this point. Obviously, she's not a very big lady, so she's got a big belly right there sticking out. And so what ends up happening, right? That baby is developing. Well, as it's developing, it's pushing out, right? Obviously forward, because it can't go backwards, right? There's a spine there. So it's going forwards. Well, you have these round ligaments, you have other tissue that's kind of supporting that uterus and everything that's in there, trying to stabilize as that baby's developing. Well, this can cause tension and tightness in that low back and also in the hip flexors. So we're working on a little bit of release right there to allow that baby from going to I'm going to use this as my uterus, right? So this is face down like that. So the baby's sitting inside there. What can happen is you can get a riding up of that ligament because of immobile joints or malpositions of the joints and movement. We call them subluxations. Well, that baby then can't really move in a lot of area because it's a small area. As
Yeah.
we work on that, it opens that back up and you see that slide. And they love it. The women go, oh my gosh, I can totally feel like he sticks his foot into a whole open area and goes, oh, what's this over here? Why do I got more room? Yeah, it just starts opening up, right? That growth and repair is literally opening up. That fight or flight is a little bit more like this, right? And so we see that on a regular basis when the mom is stressed. And it's not me that's done the studies. There are so many studies out there that show when parents are fighting, the baby is in this fight or flight stress response. When they're loving, caring, nurturing, holding, hugging, that baby gets into this more open and growth and repair and vitality. So it's brilliant. And wow, is it not cool to watch it? I mean, Chris, you've been in there, Travis and Sam, we've all been able to watch this and see it. It's so powerful. And even the mothers that go through this, just it's hard to fathom like
Right.
the power of touch and mobilization of what the body's doing. So yeah,
Yeah.
hopefully I touched a little bit on what you wanted me to talk about, but it is unbelievable. And everyone should be talking about movement, love, caring, nurturing. The biggest thing we talk about, be with your husband, hold, caress, love, skin to skin, all of that stuff is so powerful energetically for that baby and the baby's development. So
Yeah, I loved how you gave her protocol was for her husband to just hands on the belly, you know.
yeah.
Like
Oh yeah.
I just love that. Yeah.
Yeah, it's so cool. So cool.
Hands on healing.
Yeah.
Okay, so now we're going to go into some nutritional foundations for pregnancy. God gave us fuel, not just calories. Whole foods support hormone balance, fetal growth, and maternal strength. So, while like having faith, like there are things that you can add into your diet to help your baby grow optimally and help your body support what it's doing. So, adding in folate, so with leafy greens or eating liver, omega 3s, so flax seeds, walnuts, wild fish, iron and B12, grass-fed meat, which we have now delivered to our office, beets, and then, protein and minerals, so eggs, bone broth, legumes, things like this are going to be great to support the baby's growth. And we'll go into some more detail with some added supplements that you can add into your diet in the next slide, unless you guys want to chime in here.
Well, I'm gonna let Claire chime in, but I'm gonna talk about one thing about eggs, right? That is life. So, I mean, how natural and supportive is that? Also, raw milk or things like that. There's other things that you can do that literally drive and provide nutrients to the life and the foundation and the vitality, right? Anything that walked on the planet or crawled on the planet or swam in the oceans or grew from the planet, that's all nutrients for us, right? Nothing man-made for somebody who's trying to drive and develop a body or a baby inside them. It's ideal for them to eat from the planet. So, Claire, do you
Right.
want to add a couple of things, obviously, please?
Yeah. So all of our nutritional recommendations for fertility work or pregnancy and postpartum are all based on Weston A. Price guidelines, that anyone can find online and like read more about them. And we've developed some resources here. Organ meats and caviar are a big part of that plan. I mean, those are foods that we don't normally eat in our society, but for people who are willing to kind of seek those out, we do have some good recipes for utilizing liver. I would say bone broth is the number one most nourishing food because it helps to heal the gut lining and it gives you a lot of very easily absorbed minerals. And like all these foods, these pictures are great, Karissa, that you've chosen. I mean, these are all like the cornerstone type foods of a good diet. I mean, a good pregnancy diet. So you
Yeah.
get lots of the fats and even some vitamin D from the salmon. You get lots of fats and choline from the eggs. The walnuts give you some omega 3s as well, really good for brain food. And then like the beets, I mean, look at the color on that beet juice. That's very important. I actually just got off the phone with a girl who had been having some gallbladder issues throughout her pregnancy, her last pregnancy, and now she wants her next pregnancy to be healthier. So our number one focus is going to be thinning the bile that comes from the liver so that it doesn't irritate the gallbladder, because that's what's happening when your hormones go high all the way through 9 months of pregnancy. That bile just tends to get kind of thick and sludgy. So beets are the number one food to keep your liver and gallbladder running well. And then what's that top picture with the asparagus? Is that steak?
Asparagus.
Yeah,
Oh,
that's
yes,
steak. Yeah,
yes.
that's a steak. Yeah,
Grass-fed
buddy.
meat.
Grass-fed beef.
Yeah.
Yeah, I mean, it's like the number grass-fed beef with it looks like it's got some butter on it with a little asparagus spear. I mean, those are the top foods that our wonderful government has told us to avoid ever since I can remember, like probably 1985 is when they started coming out against butter and fat and beef and all that kind of stuff, which I mean, there are health conditions that, maybe you would want to avoid those foods with, but pregnancy is not one of them. These are the
No.
best foods for building a healthy human inside of you.
Yeah. Love it. Love it. Yeah. Good protein, good sources of fats.
Yeah.
Yeah, Chris, let's go into what else we kind of offer them too.
So, in addition to eating healthy foods, like there are supplements that you can also include into your diet to help nutritionally for you and your baby. So I just have a couple here, but chlorophyll complex to build the blood and prepares the body for actual birth. Cod liver oil, I know that we talk about this one a lot. Essential fatty acid also leads to higher cognitive performance. Vitamins A and D. Vitamin A is responsible for the formation of cells, tissues, and organs. Vitamin D, like you were talking about in the salmon, plays a role in lung development and protects the newborn from heart failure. Prosymbiotic is for gut microbiome and healthy bacteria. Folic acid for spinal health, and it helps boost growth. It creates new DNA, which is needed for new cells, and also can help prevent mental retardation and deformations of the mouth, face, and heart. Thymex for acute immune support, detoxing the gunk. Hopefully you're, not having gunk to detox, but if you do need support.
And what's nice about that, I want to add something too. And Thymex is not something that's going to detoxify, because we don't want to detoxify while we're pregnant. So literally, it's just going to help support the immune system's ability to clean out the system. It's never going to push detoxification. I want to clarify that, but I totally agree with what you're doing. And I wanted to add too, Karissa, that cod liver oil, that's going to have naturally occurring vitamin A and D, which is the big idea when it comes to just naturally a natural source of vitamin A and D. Because of course, your medical doctors are going to tell you what, no vitamin A. We got to be careful with vitamin A. When really, if you get it through a natural source, there's no harm in it. So sorry about that. You can go ahead and keep going on the Drenamine.
Yeah,
I love that idea.
Drenamine, essential B vitamins for stress response support, immune support. Immuplex of multivitamin, also for immune support. Zypan for upper digestive support. Eutrophin, essential to support the uterus as it maintains pregnancy and prepares for birth. Also, doctors research, shout out, we have a Simply Female that also has eutrophin in it. Can be great for any woman in any phase, but definitely pregnancy or trying to get pregnant. And vitamin E helps to construct the placenta and essential to human production.
Yeah, and that's a new product, right? That new product that's out. So like all of this right here is really kind of just encompassing everything that we would go about if we wanted to just kind of support overall. And when we talk about the first two products we ever give anybody who comes in and tells us, and it's kind of fun because being the doctor, Travis and Doc, we get to hear, don't tell this to my parents, but I think we're pregnant. I mean, we're pregnant. Don't tell my parents. So they're, because they want to do everything they can up front, right? Everybody's coming to see us is like, let me just optimize as best I can and maximize the performance and the function of my body and the pregnancy process. Chlorophyll is the number one thing we give first and foremost, and then eutrophin, right? You want to support the tissue and development, and then also support where that baby is going to be developed, just to help really support that baby overall and the mother in the development of the newborn. So
yeah. So making educated choices, doing the best thing that you can for your body and your baby.
Love that quote right in the middle too. That's awesome.
Oh yes, do it all for the glory of God.
Yeah, that's awesome.
Okay, so moving along, being pregnant, like we kind of opened up with, like it is a spiritual process. So using it as a time for spiritual growth. God is forming new life in your womb. This is the time to slow down, pray, reflect, and receive, and letting God speak to you into the identity of your child. So, daily practices can include scripture reading, like worship and journaling, praying over the baby, speaking life over your baby. Like this should be a time of like rest and really like honoring God and talking to God and just using this as a time of really spiritually developing yourself, like for you and your baby. Because I mean, like I said, this is God literally inside of your belly. And so it's a really good time for that. I know that I have, some friends that, sometimes feel like, oh, I can't really do that much. Like I don't feel productive. And it's like, no, well, this is your time to spend time with God. Like this is not your time to be productive, like you are growing a life in your belly.
it's such a miracle. You know what I mean? And
Right. Yeah.
really live and be present in the miracle, in the joy
Yeah.
of this transformation of your body to bring life into this world. I mean, it is, we've had people come in too that talked like, I've got people texting me when the baby's going to be born and this. And then I said, you know what? Stop,
Yeah.
put the phone away, send one mass text and say, listen, everybody, you will be the first one that will see the picture when this baby's born. But for right now, I am going to go inward and support me and the development of this child and where I'm going because I feel like I need to because I want to have the best experience possible. It's
Right.
so
Yeah.
simple to say that, yet they want to, I gotta post, I gotta do this, I gotta do that, I gotta,
Right.
right. And I think in this day and age, it's an awesome opportunity, like you're saying, to focus on the scripture, focus on the great, the grace of God, and really being so much more involved in your own pregnancy versus letting everybody else know about your pregnancy. It should
Right.
be
Yeah.
about
Becoming
you.
in tune with it. Yeah.
Yep.
And I just
100%.
wanted to add this to when you were talking about, like um the way that the baby responds when its parents are loving and
Yeah.
nurturing versus if they're fighting. So my Lily, she wouldn't mind me saying this, but she went and she got baptized at, 39 weeks pregnant.
Oh,
And she said Rosie was just like during the worship
Oh,
before, just like flipping, just like worshiping. It gives me chills even talking about it. But
no, no.
that's a lot of impact on your baby. Your baby knows what you're talking about, what you're reading, what you're doing. Your baby's absorbing all of that information as you're doing it.
Oh, no doubt. Yeah, that 100%. There is no doubt about it. It is a unbelievable experience to make sure that you are so in tune with it at that moment in time. That's
Yeah.
that's awesome.
Um, Okay. So, now in the birthing process, like trusting the process. So this I like this verse, she will give birth to a son and you are to name him Jesus. So birth is a natural and sacred act, and I really like this topic because like God designed it to be that way. Like the body knows what to do when you're in a calm, you know, like level-headed mindset, but also environment. So like having a peaceful birth, and it starts with preparation with the body, mind, and spirit. So, taking that time while you are pregnant to really, dive into the word and make sure that your surroundings are peaceful, but preparing your mind with like a hypnobirthing or something like that for the process so that when if you do choose to go to a hospital or something, like you're not overwhelmed by the whatever's going to go on in there. Like you have this peace and this knowing that like God has designed this process for you. So, doing birth
And I,
affirmations, planning to do however you choose, but like natural birthing environments or birth positions, getting a doula or like prayer partners. Like we wrote a bunch of prayer cards for Lily that she was reading while she was, contracting. And then also, chiropractic care through the third trimester, but really just preparing yourself in a peaceful way, through faith and not fear. Because I know that once you get into the hospital or wherever you're going, like a lot of things can happen, but if you've
yeah.
got this like internal just like connection with God, like it can be a peaceful and very beautiful experience. It's supposed to be.
Yeah, I was going to mention too. Yeah, and just that process, like you're saying, I get the idea of being fully engulfed in it, but also having a plan. Sit down with your
Yeah.
husband, sit down and go, listen, what's our plan? What do we want to
Yeah.
do? If something goes wrong, do we want to do this? Because that's when that fear comes in,
Mm-hmm.
and fear does what? Oh, they said we're going to have to do this, or oh, they said we got to
Right.
do this, or okay, we're doing it. Have your birthing plan, like understand what's happening so that you feel as much as in control as you can, but by all means, letting go and having faith in the process that that you were meant to have this child and bring it into the world. So
Yeah.
I just want to make sure we touch base on that too, because so many, they just go in there and they just go, I'm just going to go to the hospital or I'm just going to go do this. But having a doula or having something like that really gives you a chance to be more of the controller of the environment and understanding of what we're going to try to do to make it very much like natural and healthy and as positive as you can for that baby's, first breath of fresh air. So
Yeah, absolutely. Okay, and then so postpartum healing. And I think this is also a really important thing to talk about. So like after birth, like moms need support, rest, nourishment, love. Like you need to be with your baby, you need to be taken care of by your partner. The fourth trimester is real, So again, like taking all of these practices and all of this time that you've spent, in pregnancy through postpartum, like while you are with this baby that you've been praying over. So leaning onto community, chiropractic care, nourishing your body as you did when you were pregnant, and just God's presence of you and your baby. So it says here, like he gently leads those that have young. And again, like when I was going back to, I've just had friends that have, while they're pregnant, they're like, I don't feel like I'm productive or whatever. And it's like, when you're in postpartum, like your job is to take care of this baby. Like that is literally your job. And there's no other pressure. Like that is what God has asked you to do at this present time. And God will lead you in that. So taking care of yourself, and continuing to do all of those practices that you were doing when you were pregnant with your baby.
I love it. I love it. And I want to touch a little couple of things like too, Claire, I want you to jump in too. For us, postpartum, the biggest thing, I'm going to have Claire talk a little bit more about some other stuff, but postpartum, to help support that individual, that mother, that child, amazing as it is, has robbed you of so many minerals and nutrients. Like it literally, it needs everything it can to create life and to be healthy. This is where it is so important, moms. You get so good at giving back and helping your husband, helping your kids, you are just, that is ingrained in you. You are that good at what you do. But it's also about taking care of you. And this is where you put down here chiropractic care, nourishing your body. You have to start replenishing your body so that you have the tools that you need to take care of the child. And this does not mean you have to eat, 8 times a day or something like that. It just means that you have to have an understanding of what would God want put back into your body to replenish you, and what has that little baby, God, set this up too, depleted your body in so much now that you will feel more lethargic, more run down, more mommy brain, more all that stuff. And I'm gonna let Claire talk a little about this because it's so cool, some of the stuff that we know about and that we can do. And eutrophin and chlorophyll and all those things are part of, and of course, iron are all part of these ideas to help support mom. But Claire, give me an idea of what else we would recommend too for somebody who just had a baby.
Thank you for putting me on the spot like that.
Well, you know what I'm talking about.
Yeah.
Yeah.
That's good. So, two things that I wanted to kind of explain for a minute. So earlier this year, I read this really great book by Lisa Mosconi. She's a scientist who studies brain health, and a big part of the book was about hormonal changes in women and how that affects our brain. So not just in menopause, but also all the way through pregnancy and postpartum. So there is a remodeling that occurs in the brain that actually changes the way you think about yourself. So after a woman has her baby, it's like the brain changes and you become hyper focused, like tunnel vision on what that baby needs. Like you can hear like the baby breathing, and like you wake up like on the tiniest little sound, like, oh my God, the baby needs something, right? The husband is dead asleep.
But remember, that is not that's a male female thing. That is 100% true. If somebody broke a glass, that would be the husband waking up to protect. There's a difference in this. That mindset of where they are, females definitely have that ingrained in them to do
Yeah.
what? Mom, baby's whining, baby's crying, needs something, boom, go.
Right. And it's not like a conscious choice. It's literally like a physical remapping of the brain. And then this remapping happens again later when we go through menopause and we have like this hormonal letdown where all of our levels go down. Well, during pregnancy, like I said before, and how it affects the liver and gallbladder, we have this huge ramping up of estrogen and progesterone, and that's what the receptors in the brain are changing and feeding off of, and making the mom super hyper focused on what the baby needs at all times. And that enables her body to be ultra responsive to the baby. And we hadn't even really gotten into this, but mom's breast milk composition will change in accordance with what that baby needs, because the baby's saliva, as baby is sucking on her, is communicating back to mom's body and brain what needs to be in her breast milk. I mean, it is such a
Yeah,
finely tuned operation
incredible.
that we don't even know probably anything about. We're just discovering literally the tip of the iceberg on this. And
Yeah.
so that was the first part of what I wanted to explain, how mom's brain is changing and morphing so that she can give that baby everything she needs. And so first off, all the way through going through pregnancy, mom is building a huge supply of blood. Like, I don't know exactly what the percentage is. I would guess, like, I don't know, a big percentage extra blood, and it takes a ton of iron and vitamin A and the B vitamins and fats and water, like so much, so that mom doesn't get dizzy and pass out during pregnancy, not only from dehydration, but because she doesn't have enough blood supply to flow through and deliver all the nutrients. So long story short, like by the time mom delivers the baby, she's often very nutrient depleted. Most women are anemic. Some doctors would even say that's normal and expected
Yep.
and good to be anemic. But I mean, yeah, if you don't mind being like dragging around like a zombie and having no
Right.
energy.
Right.
I mean, it's very difficult to keep a pregnant lady um, in the black, without getting too depleted. But that's like our number one thing. Like, as a woman is building her breast milk, it's again a huge stress on the mom to put enough proteins and enough fats and enough nutrients into that breast milk to keep the baby growing, healing and sealing up its little gut.
Well, remember that, and that doesn't happen until like they're two. But another thing too,
Yeah,
though,
it
remember
takes a long time.
those immunoglobulins that are coming from the breast milk. But one of the things I wanted you to mention on was encapsulation of what? When we have the baby that's born, the placenta. And so they can do some of those things. That's what I was going to have you talk about giving that for postpartum would be the one thing that Claire.
Yeah, so we do like to give resources for women, or give a little reminder to, get a doula, get your placenta encapsulated. It does put back a lot of the hormones, the B vitamins, the minerals, things that have been on its way to the baby through the placenta. If you can get that back in your body, it really helps to prevent postpartum depression
Yeah.
and a lot of energy issues and fatigue afterwards. I mean,
Perfect. Yeah. That's what I want to hear that part too. That's one of the
yeah.
biggest things for postpartum, that healing. But all right, Krista, go ahead, keep going. That's been great. So keep going.
So yeah, overall, like, honor the temple, trust the designer. So honor your body, trust God. Your body's not failing, it's functioning as it's designed. You know, like we were just talking about, like this is just part of God's design. And you are not alone. God's present in every contraction, every decision. So to nourish your body, pregnancy, post-pregnancy, renew your mind, align your spine,
Nice. Look at you.
and walk in peace. So
Well, and we talk about that, right? That's above, down, inside out, right, Doc? Yeah, I mean, you guys have heard that, right? It's about that innate intelligence. It comes down right through. And if you wanted to really dive into it, you can pull something like this out, right? And just kind of think about how this all works. If you haven't seen this, you got to ask me about it when you come into my office, and I'll explain to you what we're seeing in this picture. Maybe we'll do that in a different little tidbit. But it is about that innate intelligence. The brain is where God resides. Then He works out through the rest of the body and gives all the energy out to the areas and the tissues that are needed. And I think that's what's really important about understanding the spine and how important it is to move well. So, yeah, perfect.
well, this ends my presentation.
Oh,
So I think that this was great. I'm so glad that we were all so interactive. You guys know more than I do, obviously. But yeah, did we have any more questions, comments, or concerns, or anything else we want to touch on?
no, I think you did a great job. I think there's so much to this. I think
Yeah.
the takeaway for this would be literally to just go to like taking and look back at yourself. What do you want to do? What are you doing for this? The glory of God, what's happening, how this is a miracle, the process, the whole dynamic, being educated on what you need to be doing, the intent of what you're doing your research on, and then go in there without all that fear. Have the faith, have understanding, have a doula, have an expert, have a Claire, have somebody you can talk to get ideas on what's going to happen. What do I do if this happens? What do I do if this happens? So that there now you're prepared for this process, but know that you're never alone anyway, because guess who you got with you?
God.
Yeah, 100%. And that's one of the biggest things. So we talked a lot about a lot of things that are going on, but know that you just prepare and plan and really just bask in the glory of what's going on and that whole idea of bringing a new life into this world. So anybody else want to add anything at all that I may have missed?
I was just gonna add kind of real quick off of what Claire was saying about like the mother changing the nutrient content of the breast milk. There was I don't know if it was like a while back or what, but saw a picture of a mom who had twins, and one of the twins was sick,
Yeah,
and each twin had a separate breast for breastfeeding, and the milk that came out of one breast was different that came out of the other.
100%. Yeah.
I mean, that's just so incredible.
It's just, I
That's
thought
how
that was pretty
intelligent
cool.
the body is, though.
Yeah.
That's what, but we need to bask in that. So many people just go, whatever. That's pretty neat. But no, you're like, wait a minute.
No.
That's unbelievable.
Yeah.
Like that is literally the body going, oh, I know what baby's eating from this breast. I'm gonna hammer it with this so it can get healthy, right?
Right. Yeah.
Yeah, so cool. Wow, what a cool topic. How are you gonna top this next time? But anyway,
I don't know.
so well, Karissa, I want to, from all of us, thank you for doing this. Sam, thanks. Travis, thanks for being a part of this. Claire, appreciate all that and the information. I think if there's questions or something like that, please put them below. We'd love to talk more about this. If you have more ideas, reach out to us. We're all here, always here to help out. And like you said, Chris, we don't know it all. That's what makes this fun, is by going through this stuff and just getting some of this information out, because there's so many moms out there that have no idea about this stuff. So please share, like this stuff, send this around. And I appreciate you, Chris, so much for doing this, putting this together. All right, everybody, I'm going to let you guys go. I'm going to end the recording now. Thank you for paying attention. I'll end the recording. I'll hang out with you guys just a second.